From Fox 5 News, this is Good Day Wake Up.
Also this morning, we're looking to find out how Secretary of State Hillary Clinton is doing. You know, she's still in the hospital. They found a blood clot near her brain, and we're wondering what led doctors to make that diagnosis, because that is a really scary and dangerous diagnosis. We'll talk about that coming up.
All right, thanks again, Robert. At 7:12, Secretary of State Hillary Clinton remains at New York Presbyterian Hospital this morning.
Yeah, she's been undergoing treatment for a blood clot since Sunday. Fox 5's Lydia Serrani is in Washington Heights with the story right now. Lydia, what are you hearing this morning?
Rosanna, what we're hearing is that Secretary of State is doing okay, that she is alert, she is talking to doctors, but right now we still don't know exactly when she will be released. Right here behind me, you can see that there are some Secret Services as well as photographers awaiting her release, but we are told that she is doing okay and that she is expected to make a full recovery. Doctors also say that she is very lucky. This blood clot, which was found right behind her right ear between her skull and her brain, was discovered as part of a follow-up MRI. She had a concussion earlier this month as a result of being dehydrated because she had a severe case of the stomach flu. But again, she is very lucky that doctors found this, because apparently this clot could have led to a stroke. But again, doctors say she is expected to make a full recovery, but right now we still don't know exactly when she will be released. Of course, we'll bring you the latest information as soon as we receive it. But for now, that's the latest here at New York Presbyterian Hospital in Washington Heights. Lydia Serrani, Fox 5 News.
All right, Lydia, well, we're continuing that conversation right now. Joining us this morning is Dr. Ezriel Kornel.
Dr. Kornel is a neurosurgeon with Westchester-based Brain and Spine Surgeons of New York. Good morning, doctor. Let's do a little blood clot 101 if we can, and go through bullet by bullet to help people understand this. Is what we're talking about now a product, a result of a concussion, or are these two separate things, do you believe?
Well, it certainly can be the result of a head injury. It is a bit more than a concussion. A concussion, by definition, is an injury to the brain that doesn't have any anatomically evident problems. So you don't see a hemorrhage or a bruising of the brain or any type of clot with a concussion. So if you have something like this, which is a clot in a major vein, then that certainly by definition is more than just a concussion. It can be the result of a head injury.
Let me ask you something, doctor. When we heard that she went in for a routine exam, you don't give MRIs for a routine. Obviously, she must have been complaining of other things for them to give her an MRI this past weekend.
Generally, that's true. So it's very possible that she was complaining of a headache or of dizziness or unsteadiness, which they may have initially thought was the result of a concussion. It's important to understand that this is not a blood clot in the brain itself. What they're describing is a clot, what's called a thrombus in medical terms, that is sitting in a vein, and that vein is not in the brain. It's in the thick lining around the brain called the dura. It's between the brain and the skull.
Sounds dangerous, though. It's a dangerous position, isn't it?
It can be very dangerous, because this is where the blood drains out of the brain. You obviously need blood to drain out, because blood is coming into the brain through the arteries, feeding the brain, and then has to come out because there's no pressure valve in the skull to allow excess pressure to be relieved. So if there's an occlusion that's preventing blood from flowing out normally, there's going to be a pressure buildup within the brain. And that can result in small hemorrhages within the brain.
Are these clots standalone, or are they sometimes a symptom of something broader or different?
It can be the result of something more general. We see it most commonly. It is rare in a head injury that isn't a severe head injury, such as an automobile accident with multiple fractures or a gunshot wound. That's where we see it most often. We see it sometimes after brain surgery. If a vein has been occluded, then you can develop a clot in the larger veins. But otherwise, you can see it sometimes. Again, it's rare, but you can see it sometimes in what are called hypercoagulable states, where the blood is more inclined to clot.
What causes that?
And that can occur in things like cancer in other parts of the body. For instance, pancreatic cancer is known to cause a hypercoagulable state. But again, these are rare occurrences. Whatever it is a rare occurrence. Most likely, though, it is a head injury, and most likely there was a small area of bruising or swelling that was not fully detected initially, but that then resulted in this obstruction of the vein.
I know that you're not treating her, but there are, lots of reports out there, and some of them say, maybe this signal's a bigger problem that we haven't heard of yet. In your experience, would this signal another problem?
It could, but again, it's so rare that I don't want to speculate that there is a bigger problem. What it could certainly indicate is that there is a small area of bruising or small stroke in the brain as a result of this, because it is not uncommon at all to have an area of a small stroke. It may not cause any neurologic problems. It may be that such a small stroke that she is neurologically still intact, as they say she is. But what they may not be saying is that there is this small area of stroke as a result of this.
And if we are to proceed that this is a standalone event, not connected to anything else, what do you believe the treatment time frame is? Initially, we heard 1 or 2 days in the hospital. She'll be out. I think now we're on day 3, possibly. Yeah. When do you think that she could be released?
Well, that's a good question. The treatment, indeed, is anticoagulation, giving medications that are essentially blood thinners that prevent further clot from forming, because the first thing you want to do is make sure that additional clot doesn't form, causing further backup of blood flow. So once you've stopped that, then over time the clot can start to dissolve. But until the level of the medication is sufficient in your bloodstream, you want to monitor it. And it can take 3, 4 days even to make sure that that blood level is acceptable. And once it's acceptable, then she could be discharged and followed at home.
On another subject, I know he's well-renowned in his area of expertise. Is it true you treated James Brady after the Reagan assassination?
That's correct.
I mean, this is the man to go to, And,
well, thank you.
Anyway, we appreciate you being here on Good Day New York.
It's my pleasure. Thank you very much.
And we hope to talk to you about some better things, hopefully, in the future.
Hopefully.
Okay.
Thank you very much, Doctor.
Thank
and, of
you.
course, our best wishes for a speedy recovery to the Secretary of State.
Yes.